Good evening, everyone. So, dear friends, so let's proceed for the next points of the master tongue. As per the master tongue, the points in the fingers are called 11-point unit. Point in the palm are 22. Point in the lower arm will be 33. And point will be in the upper arm. That will be 44. So right now we are discussing 33 point, the point in the lower arm. In the previous class, we have already discussed 33.01, 2, and 3. Or 3 doors. So today we will discuss other points. So let's start now. We are starting the class just right now. Okay, so don't worry for the class. So in the previous class, we already discussed 3 doors. That is 33.01, 2, and 3. And in the previous class, we already discussed that these points are available in the lower arm. So these points are available toward the thumb side, this side. And if we see the arm here, so if this is the arm, so from the yin yang junction, so this is the yin yang junction. If we go 2 chin up, then 2 chin up, then 2 chin up. So these are the 3-point unit, or called 33.01, 2, and 3, which we already discussed in the last class. And the name of these points are 3 doors. And I told you that these points are very good for piles, any problem which is connected with the anus. And the meaning of 3 doors, that which is useful for all the 3 doors in the genital part. Either this is the urinary gate, either this is the urine pathway, or this is the genital pathway, or this is the anal pathway with the help of three doors. We can treat the problem of urine like urinary tract infection. We can treat the genital problems like probably like problems of white discharge, leukorrhea, male female infertility, and many genital problems. And the problem of anus like piles, fistula, fissure, constipation. So whatever problem happening in the lower three orifices, we can treat them with the help of three doors. So we already completed this discussion. Now we are proceeding for the next point. It is called three gates. Three gates. Now our new point will start. Three gates. So we have completed the three doors. Now we will start three gates. So let's see the image. So look at this image. If we see the front side of the arm, we can tell this is the yin. Back side of the arm, we can tell it yang. The junction of front and back. So this is the junction of yin and yang. And at the junction, we are having three doors, which we already completed. Now, if we are going other side, the junction of yin and yang, but other side. So here we are having our point three gates. So we are having points about three gates. So three gates points are available on the junction of yin and yang. So look at my hand. Look at my hand. So this is the yin-yang junction. So this is the lung meridian, this side, lung meridian. On the back side, we are having large intestine meridian. And in between, there is the junction. So we have already surged 3 points. To tune up, this will be the first point, to tune up and to tune up. These 3 point units are called, means to tune up, to tune up, to tune up. These 3 point unit called three doors. Now we are going to other side. Now, here we are having heart meridian, like that. This is the heart meridian. And on the yang side, this is the small intestine meridian on the border of bone, or on the little black back side, the small intestine meridian. In between, this is the junction of black and white skin, just border. So we will find our three gates here on the border, on the side. So the first point will be Trichuna. Second point will be Trichuna. And third point will measure from this pointed part. This pointed part, I will tell you later. So from this pointed part, we will come like that. So we can feel this is the bone. The name of this bone is ulnar bone, ulnar. So we are having the point just on the border of ulnar bone. So we can feel the bone and just putting the point on the border. So how can we put the point? Let's see. So look at this. So from this wrist crease, if we go Trichul, so this is the just on the border of bone. So we can feel first bone. Oh, this is the bone. Just below the border of bone, I will put 1 point. So look at this. Generally, I am putting 1 inch needle, 1 chin needle to the patient. But right now, I am putting the Sujog needle for demonstration purpose. So this is called intestine gate, which is very good for all the problem connected with the intestine, like constipation, like diarrhea, like gas, bloating, infection in the intestine, colitis, because colitis is the infection, inflammation in the intestine, Crohn's disease, any problem which is happening in the intestine. So we can treat with the help of this point. So this point is called intestine gate. This point is very much useful because nowadays we know most of the people are suffering with the intestine problem. So this is the point. We can put this point on the right side or on the left side, no problem. So if one patient is coming to you and telling, doctor, I'm suffering with a bloating, gas, diarrhea, constipation, something disturbed in my intestine. So from the wrist crease, go 3 chun proximal. So from the wrist crease, go 3 chun proximal. That is the location of this intestine gate. So look at the location. This is just on the border. I am showing my full screen. You have to click on my image, then you can see full screen. Okay, now what are the indication and what is the number of this point? As per the master tongue, the number of this point is 33.10, 33.10 or intestine gate. So remember, the 33.10 or intestine gate And this point is very good for enteritis, any problem of the intestine. Now, if we go again, 3 chun proximal on the border bone. So I am coming to 3 chun proximal once again from this point. So we can measure with the help of 4 fingers. So this is the karate position. Karate position. In the karate position, first I will go 3 chun, that is the intestine gate. Then again 3 chun, that will be the liver gate. The second point will be liver gate. So look at here. I will feel the border bone, and I will, on the border bone, I can put the point here. So this is the liver gate. You can see the needle, very teeny needle here. Okay, one more thing. Now you can see, this is the colorful needle. We are using in the facial acupuncture. Very, very, very thin needle, very, very thin. So this is the liver gate. So first we are getting intestine gate. Then second point will be liver gate. Nowadays we know the problem, people are suffering with the problem of no. Yeah, you have to go 3 chun. Whether it is 2 chun or 2 chun. From the wrist crease, we will go 3 chun. That will be our intestine gate. Then again we'll go 3 chun. That will be our liver gate. The liver gate is very good for the fatty liver, cirrhosis of liver, any problem which is connected with the liver. Like we know, liver supply blood to the uterus. So even if liver is deficient, and because liver is deficient and any problem happening in the body, like the problem of uterus, liver is also connected with the eyes. So someone is suffering with the eye problem. Liver is connected with the jaundice. So in all these conditions, we can use this liver gate, and liver gate is more effective on the left hand. As per the master tool, liver gate point is more effective in the left hand. All the points, even we are discussing right now, and we will discuss in the future, if the points belong to the liver, so they are more effective in the left side, because liver is having yang energy. So the structurally liver is a yin organ, no doubt. The structurally liver is a yin organ. But functionally, liver is a yang organ. So the number of this point is 33.11. So the first point was 33.10 or intestine gate. Second point, 33.11 or liver gate. So when you want to treat any digestive disorder, put both the points and prefer left hand, because the liver gate point is more effective in the left hand. Now, the third point will be heart gate, because we are talking about the three gates. So first is the intestine gate, second is the liver gate, and third point will be heart gate. So let's see the location of heart gate. Yeah, the name of this point is liver gate. Liver gate. The name of upper point is intestine gate. The name of this point is liver gate, and the number of this point is 33.1011, and next will be 12. That will be the heart gate. So let's see the location of heart gate, then we will discuss little more about all the 3 points. So like directly you come to this protruded part, this protruded part of the elbow. So from this protruded part, it become 1.5 tune up or distally. So how to measure the 1.5 tune? From this protruded part, we can keep 2 finger, because 2 finger is equal to 1.5 tune. Then this will be the heart gate. Very important point. Remember this point. We are needling this point every day in the clinic, every day and every day. When you listen the indication of this point, then you will find out, oh, the excellent point, heart gate. So from the oligoclinic process, it become 1.5 tune anterior on the border of this ulnar bone. So this is the point. And when we are needling, how we are needling the point? So we are telling the patient fold the hand like that, very loosely. Or patient can do like that. Patient can keep the hand on the chest or can do like that. Then we are putting this heart gate points like that toward the wrist. So from the oligoclinic process, we are coming 1.5 tune up. Then we are searching the border bone. So this is the border bone, and here we are putting the point. Now you can see the direction of needle is upward. So this is the direction of needle. In the clinic, what I'm doing, in the clinic, I am putting this point and one more point randomly little up. I am putting 2 points here for heart gate. So this point is very much effective. We will discuss the indication of this point. So in this way, this point will be 3 tune proximal intestine gate. Next point will be 3 tune proximal, that is liver gate. And these 2 points are more effective in the left side because the liver is more effective in the left side. And this is the heart gate, which we have to needle in this way. And we can add one more point. We can insert the bunch of needle completely, no problem. And one more point can be inserted here. So let's see the one video. So first I will start from the previous class which we have discussed. So in the previous class we have understood that in the lower arm from the wrist crease, first we are putting the 3 doors. From the wrist crease, if we are going 2 tune proximal, from the wrist crease on the yin yang junction, 2 2 chin proximal, 2 chin proximal, and 2 chin proximal. There are 3 points called 3 doors or 33.01, 2, and 3. These 2 points are available on the yin yang junction. So we can insert the needle in any directions. These points are very good for all the 3 doors, all the 3 orifices like anal, urinary, and genital part. I already told you that these points are very good for leukorrhea, white discharge, reddish discharge, hemorrhoid, piles, fistula, fissure, constipation, UTI, and all. Now, after this, we are proceeding to the next point that is called 3 gates on the other side, on the yin-yang junction of the other side. So this is the yin-yang junction of other side, or we can feel the border bone. So here I am feeling the border bone because over all the 3 points, all the 3 gates are available on the border bone. So I am drawing a line between heart meridian and small intestine meridian, because in the front side we are having heart and in the yang side we have small intestine meridian. From the wrist crease we are going 3 chin proximal, that is intestine gate. Again 3 chin proximal, that is liver gate. So these 2 points are very good for the digestive disorders, for the liver problem, fatty liver, cirrhosis of liver, the problem of the intestine. Now, from this protruded part of the elbow, if we go 1.5 chin proximal and feel the border bone here, we have to search the border bone. So I'm searching the border bone here. This is the border bone. So here we can put the needle directed proximally. So in that way, first I'm putting the needle on the intestine gate. You can see here. Then the next needle I will put on the liver gate. So in this way, we are covering all the 3 points. These 2-point units are very effective for gas, bloating, and multiple disorders connected with the intestine. Let's see in other image. So look at this image. We can see the body from the front side. This is the anterior view. So look at the arm. Now I'm turning the body and looking this person from the back side. Now doing the zoom in the arm. So here, this is the radius bone on the thumb side. This is the ulna bone on the small finger side. Now we are searching the 3 gates on the small finger side, on the border of ulna bone. So let's see and make a different view from the posterior side. So I'm turning little like this. So on the border bone, so whenever we are putting the point, we are searching the border. So first point will be 3 chin proximal. Second point will be 3 chin proximal. The first point is called intestine gate or 33.10. The name of second point is liver gate or 33.11. Now for third point, from this elbow, we are coming 1.5 tune proximal. This is the heart gate or 33.12. So all the three gates together are called three gates. So coming back here. So the first point is intestine gate or 33.10, which is 3 tune proximal from wrist crease. On the border of bone, which bone? Ulnar bone. So that this, as per this name, we can understand that when we talk about the intestine gate is very good for all the problem of the intestine like enteritis, gas, bloating, diarrhea, Crohn's disease, IBS, irritable bowel syndrome. So these all problems can be rectified by this intestine gate. And the second point is called liver gate or 33.11. Again, 3 tune proximal. So this point or 33.11 is very good for multiple problems connected with the liver, like it is very good for the fatty liver, cirrhosis of liver, vision problems, because vision is connected with the liver, and very excellent for the hepatitis, because hepatitis means liver disorders. And this point is most effective in the left side, because all the liver points are more effective in the left side. Reason, liver is very dynamic organ functionally. Liver is a young organ functionally. I'm not talking about the structurally. So it is going on the young side, which is left. So whenever any person suffering with any intestinal problem, we are using both the point together. 33.10 and 33.11 both together are very excellent for multiple disorders, multiple digestive problems. Then we discuss the third point, that is heart gate or 33.12, which is 1.5 tune distal from elbow pointed part from olecranon process of the elbow. And the name is heart gate. What is the indication? So what is the indication of heart gate? Number one, the heart gate is very good for heart and palpitation, increase heartbeat, chest pain. This point is that much effective. If someone is telling you, oh doctor, I'm having lots of pain in my chest. If you put the heart rate in the right way, which I told you, which I demonstrated you, then you will see the person will tell you, doctor, now I don't have any chest pain just after 5 minutes. I have tried this heart rate point for many patients suffering with the chest pain, palpitation, different types of heart pathology. This point is very much effective for all the heart problem. The second indication, which I am, because of that, I am using this point every day in my clinic. As per the master tongue, the point useful for the heart also work for the knee. So this point is very effective for the knee pain. So someone is complaining you, can you treat my left knee pain? So we will put the point on the right side. And as soon as you put the point, you can ask the patient, okay, now move your knee. How do you feel? The patient will tell you much better, much better. And as per the experience that we have found, the person is suffering with the knee pain because knee is very vast area. So if someone is suffering with the pain in the medial side, in the inner side, then this point is more effective. And most of the patients are having knee pain in the medial side only. Even someone is suffering with a pain in the front side, this point is very effective. But this point might not work if someone is suffering with a pain in the outer side. So we can think a little more and we can add some more point. Only few patients are having pain on the lateral side. The most of the patients suffering with the knee pain on the inner side, medial side. So this heart rate point is very much effective. Now, third and more critical condition, which we see sometime in the clinic. Many times patient is coming and complaining us, doctor, I am suffering with AVN of hip. What is AVN? The meaning of AVN means a vascular necrosis of hip. Okay, whatever the name of problem, do not worry. If anyone is complaining you that I am having pain, where? In this crease. In this crease. The crease of inner beer. Sometimes person having pain on the line of crease of inner beer. This pain is also very common with the AVN patient, AVN of hip. But if anyone is telling you, oh, I am having pain here on this line. So you put this point opposite side and person will feel very effective. This point are very good. Otherwise, many times we try many points. But this pain is not going on the crease. But as soon as we apply 33.12 or heart rate on the opposite side, we see this pain disappear. So the 33.12 are very effective point for the heart, for the knee, for the palpitation, for the cardiac problem, for the enlargement of the heart, for the carditis, cardiomyopathy, and the knee pain, osteoarthritis of the knee, multiple problems connected with the knee. So 33.12 point is very much effective for these all conditions. And this point is especially effective for the pain in the medial knee. And this part is called groin. growing. So we can tell pain in the growing can be rectified by this point. So the indication of 33.12, number one, it is good for heart. Number two, it is good for knee. Number three, it is good for growing pain. And number four, the heart gate point is very effective for the pain in the tailbone. So if someone is suffering with the pain at the lowermost part of the tailbone, we know this is the spine, and someone is suffering with the pain here in the tailbone. So this point is very much effective. The tailbone means the lowermost part of the spine. So we can see this image. Sometime what happened? So this is the patient. This is the femur bone, which is in the thigh, which is available in the thigh. And this is the head of femur. This is the head of this femur bone. And this is the, we can see hip bone. The bigger is hip bone. And femur and hip bone together making one joint here. So this is the joint where head of femur is attaching with the hip bone. Sometimes this part, the bone of this part, bone of this part is going toward the death or going toward the necrosis. The necrosis means the death of the particular part. So this disease is called ABN, ABN of hip. So when this patient going to the doctor is telling that we have to change your hip bone, the very bigger and major surgery. But we can improve the circulation of this junction of the femur and the hip bone by this heart gate point. So this point is very much effective for the AVN of hip. This AVN is creating the pain in the groin area which I told you, the crease of inner beer. So in this way, this was the indication of all the 3 points. And this is the completion of all the 3 gates. 3 gates completed. If needle is not available, then we can do acupressure. We can apply seeds. The liver gate is very effective, even for the liver cyst, the cyst in the liver. The indication of 3 gates are different and the 3 doors are different. 3 doors, most of the time we are using for genital problem or the problem of the in the anal root. But when we talk about the three gates, the intestine gate we use for the intestine. The heart gate is very good for high BP. But we cannot reduce the high BP with the help of heart gate. We can balance the heart. Then how to reduce the high BP? We are having some different points. We will discuss them. If you are not putting the needle in the directions which I told you, then I don't think something reversed will happen. Because Master Tung used to put in this way, and I am following the same formula. You can try. If you want to apply both the points, like three gates and three doors, there is no problem. But if you are applying the very effective point at a time, like I have seen the very excellent results only with the heart gate, only with the liver gate and intestine gate. So if you are using the three gates, three doors, it will become too much effective treatment. Energy will move too vigorously. So better to go with one. In the Master Tung Acupuncture, there is no direction is mentioned. So don't worry for the directions. Just put the needle. If you want to put the auricular needle, then it is good starting. So you will gain the confidence. And after that, you can go for the bigger needle. Like this needle, this is the colorful needle I'm using for the facial acupuncture. Very thin, very, very thin, not creating any pain. So if your patient is very delicate, but okay, patient is strong, but you are not that much confidence, having that much confidence, then you can start with a very thinner needle, or you can start with the sujok needle. Even with the sujok needle, we are achieving the results. Many times needle is not there. We are putting the sujok needle, but in the lockdown, needle finished. Then we were having only sujok needle. So we were putting the sujok needle on the master tung points, and we have seen the good results. We cannot do the bilateral needling. No, bilateral needling is not allowed here. In the thigh, we can do the bilateral needling in many points, even in the lower leg. But in the upper body part, we don't do it because it creates a very strong energy reactions. We can definitely use the master tung point with the TCM. There is no problem. I am also using, I am also doing combining. No problem. We can use them. There are many points who will come in the different body positions, like the heart point we have found on the face, the heart point we found on the scalp, The hard point we are finding here. Each and every point we will find everywhere. Then slowly and slowly we will develop the sense that where to use which point. Because all the point, even we got the lungs point here. And shortly we are also going to discuss the lungs point here. So the point will be spreading in each and every body part. Okay, let's proceed for the next point. Now, as per the master tongue, we are having 3 points this side. 3 points this side. How many points completed? How many points? 6. Now, 4 points will be this side. 4 points. 4 points will be in the yin surface. So let's proceed and see the 4 points. And the 6 point will be here. So all the 16 points will get completed. So start from the 6 point. That is more easy way to learn. So from the wrist reach, make a 1 point here on the triple warmer 4. So this is the location of triple warmer 4 on the wrist reach. And reaching to this pointed part, actually we are having 2 bones here, 1 bone and 2 bone. We are having 1 bone here and 1 bone here. In between we are having 1 depression. So make a 1 mark here. So these are the 2 bones, 1 bone here. This is the very important. This is the depression and 1 bone here. So these are the 2 bones. And in between we have made 1 mark, and 1 mark will be here, just in the center. Now, if we draw these 2 lines, if we draw a line, continuous line, from this point to this point, so this is called triple Boron meridian. Simply, we are telling the triple Boron meridian is just in the center. Is just in the center of the dorsal side. Okay, so this is the midpoint of these 2 bones. On this side, we are having 1 bone. And on this side, we are having another bone. On the thumb side, we are having radius. On the small finger side, we are having ulnar bone. In between, we are having depression. In this depression, our triple Boron meridian is going in this depression. So following the depression and coming till here. So near about at this location. Okay, so now this was the little Now I am going in very easy way. So look at the midpoint of the wrist. From this, if we go forefinger. So this is the very famous point as per the acupuncture. The name of this point is triple warmer 6. The triple warmer 6 is the very good point for constipation. So that's why this is called empirical point of the constipation. So from the wrist crease, if we go forefinger, so this is the location of triple warmer 6. So as per the master tongue, from the wrist crease, if you go 3 finger, if you go 4 finger, draw a point here. And follow the line of the triple warmer. Follow the line of the triple warmer. Then we will find some other points. So first let's see the triple warmer meridian. So everything will be easy for us. If you look at this position, so from the dorsal wrist crease, if we go in the center, so this is the location of triple warmer meridian. Let's see in the other image. Look at this image. So this is the radius bone, and this is the ulnar bone, ulna bone. The radius bone is on the thumb side. The ulnar bone is on the small finger side. In between, we are having one depression. In this depression, we are having our triple warmer meridian. So we can feel the depression between the bones, and we can find out the triple warmer meridian. So I told you from the wrist crease, if we go 3 chun proximal, 3 chun. 3 chun are 4 fingers, because if we want to measure 3 chun, we can measure with the help of 4 fingers. So from the wrist crease, if we go 3 chun proximal, that is the location of triple warmer 6. As per the traditional acupuncture, this is very good for the constipation. This is the empirical point of the constipation. So now, if we want to discuss something little more about the triple warmer 6, so the triple warmer is the couple of pericardium, and the pericardium is the covering of heart. Covering of heart. So when you insert the needle on the triple warmer, when we stimulate the triple warmer, it will balance the pericardium and balance the heart. It will balance the palpitation. It will balance the chest congestion. So it will balance the multiple condition which is connected with the chest cavity, because as soon as you insert the needle on the triple warmer, it will balance our couple, that is pericardium, and the pericardium is the covering of heart. So as soon as you insert the needle on the triple warmers 5, I have seen the very good results for the patient having palpitation. So we are following the dorsal line from the wrist crease. We are going 3 chun proximal. That is the location of triple warmer 6. And this point we are using for the constipation, because this is the empirical point for the constipation. We are using this point for the palpitation. We are using this point for the chest condition, heart condition. I have seen very good results in the palpitation. So patient is complaining us that I am having some congestion in the chest congestion. So we are considering this as a heart or pericardium, and we are putting the triple warmer 6 on the right side, and we are seeing the results on the heart. Why we are choosing this point, triple warmer 6? Because triple warmer 6 is working on the heart and pericardium, also working for the constipation. So many times person having lots of indigestion, gas, bloating, stool, and this is creating the heaviness in the pressure in the chest cavity. So person is having heart problem. So with the help of this triple warmer point, we are working for dual purpose. The second thing, why we choose the triple warmer? As per the organ clock, the timing of triple warmer is 9 to 11 in the night. And if we go in the morning 9 to 11, that time go to the spleen. So as soon as we insert the needle and the triple warmer, it is also balancing the spleen, and spleen is connected with the bloating, gas, and multiple problem connected with the digestion. So the choosing the triple warmer 6 is very good point for the chest congestion, because many times person having bloating, gas, abdominal distension, and having heaviness in the chest. Because whenever any patient coming to you and telling, doctor, I am having chest pain, many times it is connected with the indigestion. So in that condition, with the help of triple warmer meridian, we can treat the spleen, we can improve the digestion, we can treat the constipation, and as well as we can treat the palpitation and heart condition, because we are also working for the pericardium. So Master Tung told, let's do little more effective treatment. How to do the more effective treatment as per the Master Tung? So Master Tung told, so from the wrist crease, if we go 3 chun proximal, or I am writing in the finger, so it is very easy to understand. So from the wrist crease, this is the wrist crease, or we can tell it dorsal wrist crease. This is the wrist crease. Now we are going 4 fingers. This is the point number 1. Okay, this is the point. Then we are going 3 fingers, marking another point. Then we are going 2 fingers, marking another point. So first 4 finger, then 3 finger, then 2 finger, marking 3 point, and the number is 33.04, 33.05, and 33.06, called fire point. Why we are telling them fire point? Because increasing the fire so that digestion will become normal. Spleen will become happy. Spleen like fire. Spleen doesn't like coldness. The sluggishness of the intestine can be rectified and heart get enough circulation. So from the dorsal wrist crease, first we are going forefinger. So from the dorsal wrist crease going forefinger, marking point, then three finger, marking second point, then two finger, marking third point. So 1, 2, 3. So this is called Dao Ma. The meaning of Dao Ma. If you insert the single point, it will work nicely. No problem. It is also going to work. But when we insert double point on the same line, the effectiveness will be very high. And when we insert the triple point on the same line, this point protocol become very effective. And this is called Dao Ma of the fire point. And this point protocol is 33.04, 33.05, 33.06 are very much effective for the palpitation, heart condition, constipation, bloating. In these all conditions, we can use them. So 33.04, sorry. 33.05 and 33.06. So from the wrist, going 4 fingers, then 3 fingers, then 2 fingers. I am writing in the finger. If I want to write in the chun, then 3 chun, 2 chun, and 1.5 chun. But remembering in the form of finger is more easy. So these points igniting the fire. So very good for the heart, palpitation, chest, heaviness, as well as constipation, as well as good for spleen. And spleen is connected with the bloating. So in these conditions, we can use these points. If someone is suffering with the local problem of the hands, like having some pain, then also we can use these points. So these are called fire points. Let's see the practical demo once again. So look at this image. From the dorsal wrist crease, if we are going 4 finger, then 3 finger, then 2 finger. These are the 3-point unit. We can search the gap in between radius and ulna bone. And in this gap, we can put the points. So these are the 3 points which are very good for the chest heaviness. With the help of these points, we can improve the fire, we can improve the energy circulation. These 3 points are called fire point as per the master tool. Yeah, I'm showing the chart. I told the local hand problem, like someone is having pain in the hands. That is the local hand problem. Someone is suffering with a pain or some cramps, convulsions, any problem happening in the local hands, in the hands. That is called local problem. So this was the 3 point combination, the fire point. One patient came, she was having lots of swelling in the legs. Then I asked, oh, how did you get this swelling? The patient told me that 15 days ago, I was sitting in my garden made by stone. Stone was too cold because we know if we walk on the mud, then it is okay. But if we are walking on the stone in the cold season, in the winter season, it is too cold. And the cold may attack from the feet. So the lady told, I was sitting on the stone without wearing anything in my foot for 2 hours. And the son of lady told, yes, it was too cold stone. Even I was unable to stand for 1 minute and she was sitting for 2 hours. So that day, the cold enters in the body. She got attack of the cold. And slowly he developed lots of problems like swelling, like the chest pain, like constipation and multiple problems. So I increased the fire with the help of these points because these points are connected with the spleen. So I was also having in my mind that I have to remove the swelling, I have to increase the fire, I have to work on the heart. So with the help of these points, I treated the lady. She got very good benefit. Treatment is still going on. Right now, treatment is going on. She is getting benefit. She got the severe chest pain. The pain was referring in the hands. I thought she was very near to the heart attack. But as soon as I have seen the jerk in the hands, pain in the hands, it was referring till the small finger. I inserted the heart gate immediately. I inserted the 4-fire. And I inserted one more point, which I told you when we'll discuss. I inserted the 1-2 point locally that we discussed in the TCM, the G cleft point of the heart. And then she become absolutely normal. Now she is still suffering, but 30% cured. We will take more days to cure her. So the vein coldness is entering in the body. It is damaging the spleen. It is damaging the heart. So person is suffering with the indigestion problem, bloating, distension of the abdomen, as well as may suffer with the cardiac pain, with the angina pain. If we don't arrest the problem on the time, the person even may suffer with the attack or a stroke. So these points are very beneficial. No need to do moxa here, but we can do the moxa on the navel, around the navel. That is also, moxa is also very good treatment for this types of patient, but no need to do here moxa. If you want to do moxa, the most effective points are navel region, stomach 36 and spleen 6. Because spleen love heat. If you tonify the spleen, it will balance many things. And doing the moxa around the navel and on the CV6 point, CV6 is the point just 1.5 twin below from the navel, will ignite the fire. So here no need to do moxa, but moxa is very good. Moxa is very, very good. Okay, so enough for now. अब हम 2-5 मिनट का ब्रेक करते हैं, फिर हम हिंदी में बातें करेंगे. So now, my dear friends, I want to tell you one more thing. From the 17th onwards, we will start the class sharply by 3. Sharply by 3. Because my another class is starting, that is facial acupuncture, by 5 o'clock. So if I late this master tongue, then my next class will be late. So I have to finish every class on time. So for that, I have to start every class on time. So today is 14. So 15 and 16. And from the 17 onwards, we will start class sharply at 3. Thank you so much. अब हम हिंदी में बात करने के लिए 5 मिनट का ब्रेक देते हैं.